Welcome to the self-evaluation episode of the ASCO University Weekly Podcast. My name is Ezra Cohen, and I am the co-director of the Head and Neck Cancer Center here at Moores Cancer Center, University of California, San Diego. We will be talking about a case of locally advanced squamous cell carcinoma of the head and neck who has been treated with chemotherapy and radiation. This is a 55-year-old gentleman with oropharyngeal cancer, initially staged as T3N2 or stage 4A. He was treated with high-dose cisplatin and radiation for 7 weeks, which comprised standard therapy for this disease. He completed his therapy 12 months ago. Initially, he was doing quite well with improvement in his symptoms, but recently he complains of severe fatigue, forgetfulness, dry skin, and lack of sexual drive. He also has a dry mouth, but is able to eat solid food. Which of the following is the most appropriate next step? A. Order a PET-CT scan to rule out brain metastatic disease. B. Start patient on amphetamines. C. Check TSH and free T4. D. Explain to the patient that this is a normal part of the process and he may never feel back to normal again. Or E. Send patient to a psychiatrist to evaluate for possible depression. The answer in this case is C. Check TSH and free T4. Let's review all the responses and see why C is the most appropriate choice. First, we do know and recognize that hypothyroidism is a common complication of treatment for locally advanced squamous cell carcinoma of the head and neck. In fact, in one series, it was as high as 60%, with a median detection of hypothyroidism at 8.2 months. Of course, the incidence of hypothyroidism increases as the intensity of therapy increases, that is to say, in patients who have had trimodality or even dual modality with chemotherapy and radiation. We expect that the majority of these patients, within 1 year of therapy, will have hypothyroidism. If detected early, this is a relatively simple issue to manage with, of course, thyroid replacement therapy. Therefore, a high index of suspicion has to exist for hypothyroidism in these patients. The management of hypothyroidism is likely to be lifelong, and patients should be aware of this as they begin therapy. The other choices are not unreasonable, but because of the circumstances with locally advanced squamous cell carcinoma of the head and neck, are less likely to be appropriate. For instance, metastatic disease to the brain in squamous cell carcinoma of the head and neck is actually quite rare, and evaluating or obtaining CT scans or PET scans to evaluate for this would be very low yield. In addition, starting patient on amphetamines, although may help the fatigue in the short term, would have potentially dangerous consequences in the long term. In addition, we do recognize that depression is common in these patients, and in fact, several series have noted about a 50% incidence of depression. But the other symptoms that this gentleman has, including the dry skin, the lack of sexual drive, really hint at potentially a different process going on, and hypothyroidism becomes the more common entity. We do continue to have a high index of suspicion for depression. Patients should be screened for this and asked for this, and their caregivers should also be included in this conversation. So depression is common and should be managed appropriately, but hypothyroidism in this case appears to be the more favorable answer. Lastly, when patients have symptoms of their disease or of the consequences of its treatment, one should recognize that some of these may be a normal part of the process. Many of the symptoms can improve over time, and in all cases, the diagnosis should be sought before being told that this is a normal part of the process. Thank you very much for listening to this week's episode of ASCO University Weekly Podcast. Once again, my name is Ezra Cohen, and I hope you've enjoyed this podcast on locally advanced squamous cell carcinoma of the head and neck.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.